What do a cruise ship, an airplane, and a forgotten clinic room have in common? They're all places where patients needed care and connection.
In this episode of Out of Network, we're sharing the stories that changed how we practice medicine. From a life-saving call mid-ocean to a deeply personal moment delivering bad news, to the moment one patient was literally left behind in stirrups.
These aren't just stories. They're the reason we left the system and the reason we fight to truly build something better. This is a very heartfelt but also a hilarious episode. We hope you enjoy it.
And welcome to another episode of Outer Network Podcasts. My name is Dr. Rishi Seth, and this is...
I'm Dr. Ryon Parker.
Today we're having a little bit of a lighter podcast. Thank you so much for joining us. We have some guests. This is Archie. He is a Regal Labrador his actual name is Archibald. And that is Bella. She's our little Havanese.
How old are they, Dr. Seth?
Archie is 6 years old. But he is very childlike. And Bella, I believe, is 9 years old.
And she's a little deaf.
She likes to say she's hard of hearing.
Okay. Yes. Sorry, Bella.
She is. We think she's hard of hearing, or I think she just ignores me. There's many people in this family that do that.
Did you ever want to be a vet?
I didn't even have a dog until after medical school. So
Your wife says that you're slightly allergic. Is that true?
Very allergic. So I am allergic. I am also
Looks like Archie and Bella are coming out with...
Yeah, that's right. So like his saliva, his hair. Yeah, I'm very allergic, but I still love them, so that's why they stick around, and my son is a big fan of them. So but yeah, I didn't have a dog until medical school. And then
You're so something.
I was actually deathly afraid of dogs.
Really?
I got bit when I was a kid, and it just scared me.
Traumatized you.
And I used to if I saw a dog, I would run away. I was terrified.
Wow.
And I was terrified until I was in my 20s. And then I went to the lake with a friend of mine, and some guy brought his chocolate lab, and I think I had a few drinks at the same time. And I was like, this dog is great. And after that, I was a dog fan. So
I'm an animal lover. We have a 14-year-old miniature pinscher at home and a brand new toy Pomeranian, Brody and Gucci.
What are their
names?
What are their names?
Brody is the Min Pin and Gucci is the Pomeranian.
Gucci.
She likes Gucci. And she does have a Gucci collar. So,
So which one so what's their attitudes like? Their personalities?
Brody is very much set in his ways. 14, likes to sleep a lot, and Gucci is just nonstop aggravating the hell out of him. So, but it's bringing back a little bit of his youthfulness that he's lost the last few years. It will be a very, very sad day when Brody says goodbye.
These guys are inseparable. He is a very anxious lad, and so he has to, be walked a lot. And when he's left at home, if he's not with her, he gets extremely anxious. So
yeah,
she's a calming effect.
I love it. Yeah, I love it. They really are.
Yeah.
I could never be a vet because I cannot handle seeing animals suffer.
Yeah.
And I really can't.
So I know they're sweet.
Beautiful stories.
Yeah. So, so you met part of my family here. Let's talk about our journey onto becoming doctors that we are here today.
Yeah. I think there's many stories that define us and catapult us into certain different directions. Yeah, certainly throughout my education and career, I can remember several stories that will always stay with me and I think has made me who I am today. Several that have been very challenging and scary and heart-wrenching, and others that have been very uplifting. So, as a physician, we see the birth of children.
Yes.
the welcoming of life, but also holding hands as we say goodbye.
Yeah.
And it's, I can think of no other career where I get to actually be a part of that with patients. And so it's wonderful. And the stories that I was whole. So, I think, people always ask me, was there any one thing, any particular story that really brought me or wanted me to go into medicine or even concierge medicine? Right. Yeah, I think there's a few. One I'll never forget. I was at the University of Nebraska Medical Center. I was doing a 4th-year sub-internship in internal medicine. And so a sub-internship is basically a 4th-year rotation where you're acting like a intern, so a first-year resident. And I had admitted a young lady for abdominal pain, and she was in her 30s. Had 2 small children, the epitome of health. And she was hospitalized for abdominal pain and ultimately was diagnosed with a mass on her pancreas.
Oh, no. How old was she?
33.
Wow.
2 children, 2 and 5, if I remember right. And so obviously shocking. And I was the admitting intern, sub-I, at the time, and really formed a really good relationship with her in the short time that she was in the hospital. And I'll never forget the attending physician after we had done the scan. He had recommended some additional endoscopic ultrasounds. Obviously, we needed the biopsy, which she ended up having. But I'll never forget the attending saying to me, Ryan, you need to go in there and you need to give her bad news.
As a sub-I?
As a sub-I.
So to put this in perspective, you're still a 4th year?
I'm still a medical student. Not even an MD yet. Haven't graduated.
And they're asking you to give a 33-year-old female
bad news. Yeah. The attending said, you have to learn somehow. And by the way, you have to learn somehow, but I'm going to lunch.
It's kind of rude. It's kind of an asshole.
So I worked with my residents and I was very nervous. I mean, I feel God has definitely given me some good skills, and I'm definitely a people person. And I worked with the resident. I said, this is the first time I'm going to be doing this.
Yeah.
And I don't know how to do it. And I remember the residents basically telling me, you need to give facts and you cannot sugarcoat it. I mean, this is what it is. But I also remember her saying, you need to also, no matter the situation or the circumstances, always give a little bit of hope.
Sure.
And despite what you may or may know about the condition,
yeah.
I think people really need a little bit of hope in some of the uncertainties. So I prepared, almost had this speech written, and I walked in, and it was a very dimly lit room. It was I think it was Clarkson Hospital, in this old corner room, not a lot of light, dimly lit. She was sitting up, TV was on. I walked in and I basically proceeded to tell her the results of the scans and the results of the biopsy.
Right.
When it was pancreatic adenocarcinoma.
Right.
And you and I both know that for all intents and purposes, that is a death sentence. And I gave her the information, and I'll never forget her sitting up. And she looked at me, and tears started to form in her eyes. And she said, how am I going to tell my kids?
Yeah.
And that really, really got to me. And I said, you are just going to love them.
Yeah.
And you are going to take this 1 second at a time.
Right.
And probably for the next hour, her and I just shared stories about her kids.
Yeah.
And her family. And here I was, a total stranger to her. And yet I was invited into a very sacred ritual of getting to hold her hand and be a part of some really devastating news.
Yeah.
But I thought in that moment, really the pivotal impact I have as a physician and And it will always stick with me because I know it is a journey that we share with patients, and patients really are relying on us to help guide them is the best way that we can. We talk about patient advocacy. We talk about healing, but patients at the end of the day really want someone to be there for them and to share that journey with them. So, yeah.
There's a lot of stories. I mean, I think I could, as you were telling me stories on this, I'm just like, they're running through my head. All the cases that I've gone through, the ones that are impactful, the ones that are disturbing, the ones that make you cry, the ones that make you laugh, right? You know, and I think that's one of the ones that make you think, why the hell did I go into this profession? I mean, that happens a lot. And, you know, like, it's such an interesting experience to be a physician because you walk in the door, you close that door, and the amount of connection you can have the opportunity to make with that patient and the amount of information that you find out and how much you can help and make good to that patient is incredible. Like the fact that you're able to sit with that patient for an hour, talk about stories, you've changed the trajectory of her treatment.
Yeah.
You know, I always describe that story with my mother. My mother was diagnosed with breast cancer. When she was diagnosed with stage 4 cancer, her experience with the physician was not ideal. She was alone. She had lots of questions, but she couldn't spit it out. And the physician was only in the room for a short period of time. And that, not only did it upset her, it upset us. And so
imagine if you weren't there to be there for her.
Right. And I wasn't physically there for her. She called me on the phone afterwards. And I always, you know, talk about like, I wish somebody had been there so that they could have, you know, helped her, because maybe she could have asked questions that she held on to for months later. But, you know, I mean, we move forward, I move forward, and I've been able to learn quite a bit. I changed a lot of my practice that way.
I just want to add, I remember when I had talked to the resident about delivering bad news, and she said to me, you have to get that out first, because everything else after that, she is not going to remember.
Yeah.
Oh, you could tell her that she has cancer.
Yeah.
And that this is not a very good diagnosis.
Yeah.
And she won't remember anything afterwards.
Yeah.
I don't know. I know I did, and I certainly will always remember her, but yeah.
Yeah. No, I think that's what happened with my mom. She heard cancer spread, and I think I even asked her a million times, like, do you remember what was said? She didn't remember anything. So you're exactly right.
Yeah.
But I mean, there's times I had a case where, and there are 1,000 cases like this, but there was a case where there was a young 20 some odd year old girl, and I say girl because she was so young in the adult medicine world, and she had a non-treatable form of glioblastoma multiforme, which is primary brain cancer. And she had gone to like all sorts of hospitals all over the country to get treatment. She had been told that she was, you know, not a candidate for any additional treatment. And so I ended up admitting her into the hospital for pain control. And her cancer doctor comes to me and says,
she goes to hospice.
She needs to go to hospital. There's no other option for her. And, but she's not giving up. She has strong faith, and her husband, who they had got married because they knew that her diagnosis was there.
Mm-hmm.
And it was the most incredible family I have ever seen. Like that family was lined up in the back of that room, just like holding their hands in a dark room, because her symptoms were headache. Mm-hmm. But she had very, very bad headache, and she was like, she was just doing her best to stay strong, because she was like, I'm a fighter. I'm going to fight this. And she had belief that she was going to be able to do it.
Yeah.
And the family was watching her like suffer, but they also knew that she was a fighter. So they wanted to honor her, allow her to fight.
Yeah.
But at the same time, respect her wishes if she decides to change her mind.
Right.
And as the physician, I'm not there to fight with her. Right. I do have to tell her like what I think, but I'm not going to fight her. And so I said, well, what can I do for you?
And then giving her options.
Yeah. Yes. And so I asked her, what can I do for you? What is your goal? And she said, I just want the pain to go away. And I said, okay, I'll figure something out. And so now like when you have a space occupying lesion, a brain tumor that's growing, and it's, it bleeds inside, it causes pain. There's not a lot that you can do for pain relief. I put her on maximum medications on what's called the personal button pushing pain medication delivering PC. It's called PCA, but these are medication driven narcotics that are driven in the IV form that she's pushing every second she has pain, and it's not touching.
Wow.
And we're hitting the maximum dose of medication. It's not touching me.
Wow.
So I called a couple friends of mine. I called a neurosurgeon too. I said, is there anything do you know of that I could try? Because I'm looking up on our up-to-date websites. I'm calling my neurosurgery friends. I'm calling my neurocritical care doctor friends. I'm like, please give me some advice. And one of them goes, give them this medication, this mannitol. It's hopefully it reduces intracranial pressure, and it may work, it may not.
Yeah.
And I come to her and I said, okay, let's try this. Let's see if this is something. And she's in so much pain. She said, whatever you can do is fine. And we're on the oncology wards, and we administer this, the dose based on what I was recommended from the neurosurgeon, and the pharmacy physician was helping me out as well. So we dose it, we give it to her, and she lets out this sigh of relief, this like a gasp of sigh. And it's like, and I remember how long it was. And then she took this deep breath in, and she goes, okay, I'm done. And her whole family is sitting on the side, and I am like beside myself to hear that she had this moment of clarity with the pain relief.
To make the decision.
Right, to make that decision. That her decisions were based on so much pain, right? And when she had that clarity, she had the ability to make the decision. Now, we still waited because she had a lot of narcotics in her, and there was I always want the patients to be clear-minded before they make any decision. And obviously, her family and her surrogate decision makers were there too. But that was the first time the family had seen a sense of relief in her in weeks. And so I came back to the room later, and I asked her, like, how can I help you? What can I do for you? And then she's like, I want to continue how good I feel. I want to spend time with my family, and I'll make the decisions. And she eventually chose to go with hospice. And I mean, I actually would see her father or her father-in-law in the hospital periodically, and just a wonderful guy. And that's another great thing. Is like, you get this connection with the patient, and you give this great relief. But then when you have the opportunity to spend time with families, like, they remember you. They remember you in the hallway. They remember you, and they know that you were there for them in their time of need, and that's an incredible feeling. And those are some of those moments that really stick out to you and say, well, this is the reason why I was doing this.
Yeah. And I hope you always get that sense. I mean, like I said earlier, medicine is a calling.
Yeah.
And no other profession allows you to do that. So it's an honor.
So let me ask you a question, because we were talking about this last night at dinner, and I kind of wanted to reach out. And so you would describe a story of like extreme stress. You used to work, remind me, you used to work on a cruise line?
Part of my curriculum vitae is I am a cruise ship physician.
Which cruise line?
It was actually Royal Caribbean.
Because I bet you the Carnival physician has way better stories.
Carl Pitt.
So Ritz-Carlton?
What is that new show that has the concierge doctor on the cruise ship? What's the name of that?
I don't know.
Dr. Odyssey.
Is it Dr. Odyssey?
Dr. Odyssey. Yes. I've never seen an episode, but that would be...
I watched that. I watched that poop cruise, Netflix documentary, and that has scared me for all cruises whatsoever.
Yes. Yeah. I don't know if I ever want to be on a Carnival cruise ship. Anyway. I was a cruise ship physician directly after COVID. I had an opportunity that was actually presented to me, and I thought, this sounds fairly interesting. I have a physician already working in the practice. Why don't I take this opportunity? Certainly the salary was very enticing, but I thought, I'm always open to suggestions to become a better physician and develop those skills that I may or may not need in the future. So yes, Royal Caribbean hired me for a short stint. I was on the Independence of the Seas. And
Which I've heard is a really nice cruise.
Right, very nice. Yeah, it was mostly in the Caribbean that we would sail to, the same route back and forth. So sometimes week on, week off, 3-day cruise to the Bahamas, go away, and then back.
And how many days or how many years did you do this for?
It was a very small stint. I think it was a 40-day, 8-week contract.
Okay. Oh, okay. Oh, so it's a short amount of time.
It was a short amount of time right after COVID. They had no physicians, and they desperately needed physicians as they were trying to get back into the swing of things.
Oh, I see.
When I went on the ship, I actually had to be quarantined for 2 weeks, which was challenging.
So you quarantined on the ship
For 2 weeks.
like in the room?
In the room.
Oh, man.
I had a stateroom. Thank God there was a balcony. But I could...
Did they bring you food?
They brought you food 3 times a day. You could not leave, though. And it was... It was a mental game.
Oh, that's like prison.
It was.
Solitary confinement with a balcony.
Big time. Big time. So was there for 2 weeks, and thankfully it was hate.
Yeah.
That was not too bad. So I was doing jumping jacks in the stateroom. But I met, there was 2 physicians that I still keep in contact with today. Dr. Ed, he is from South Africa, excellent physician. And then Dr. Misa, who was also an American trained physician. And then there was several nurses and staff. But, it's interesting. I thought being a cruise ship physician meant that you just took care of passengers who were sick or hungover. And it was actually not. Most of my day was spent taking care of the crew who needed medical attention.
Oh, really?
Correct.
So it wasn't the passengers.
You would obviously have that role, of course, when the ship was sailing. But for the majority of your job was to take care of the crew. Let's keep in mind, the majority of the crew are non-U.S. citizens.
Where are they generally citizens from? Or where are they from?
All over the world. And I'll never forget the day that Russia invaded Ukraine.
Okay.
I was on that ship.
You were on which ship? The enhanced
ACs, yes. I was on that battleship.
Yeah, I was like,
Going to war.
not really that close. No.
I haven't been first one home. But I remember several Ukrainian crew members who were in tears.
Oh, wow.
And also several Russian crew.
Yeah.
Very interesting dynamic.
Oh, wow. Yeah.
And because here we are an international city. I mean, from all over the world. But so it was very interesting to be a part of that. But taking care of people, different cultures, different backgrounds, different expectations, different understandings of health. I mean, it was really being an urgent care physician.
So from a position standpoint, did they communicate with you in English, or did you have difficulty with the communication?
I mean, and everyone spoke English. Broken English, I would say. Some individuals had broken English.
Did you have a communication system with them?
Sometimes there was a friend of a friend who would come in and translate for them.
Okay.
I think that was part of job requirements, but they had to be somewhat proficient in English to be hired by Royal Caribbean.
And so we're talking not only the front end staff, but the back end staff, the engineering staff.
I took care of everything from the dishwasher to the captain.
Okay.
Of the ship.
Okay. All right. So what was give me an example of something that you thought was pretty interesting that you saw out there?
I'll tell you, it was an emergency situation. I'll definitely talk about that. But the majority of cases were really just cough and cold.
Okay.
But I'll say that one of the things I'd love to somehow help them out is there is not a lot of healthcare at port. And again, I know a lot of these crew are non-U.S. citizens, but I wish there was some type of better onshore health care clinics to help some of these patients, because when they are in port, if there's an issue, you just go to the emergency room. You are bussed to the local emergency room, either in Orlando or Miami. And I was taking care of a pregnant female who needed ultrasounds.
Yeah.
And we could not get her into an OBGYN office.
Right.
Number one.
And this patient was a passenger?
She was a crew.
So, she was a crew who's pregnant.
Who was pregnant, but about to end her contract early because of the pregnancy.
Oh, I see. Okay.
But she was having some health issues and some bleeding. And so, yeah, the only thing we had to do is, emergency room.
Yeah.
But she also had to, in other words, she couldn't just get on a plane and go home. There was some time delay that I know personnel was working with her on. But I thought in that moment, I wish there was a better healthcare entity that could help. Yeah, prove it. Yeah, because they were very, very hard. I mean, eyes were very much open. This
right,
and learned a lot. But I'll never forget that really put my skills to the test. So I went from being an internist to an emergency room physician. I was the physician on call, and there was a young male in his 40s on a trip with his wife, who I think for all intents and purposes was relatively healthy, not a lot of risk factors for heart disease, and ended up developing what we call acute coronary syndrome. So he was having truly a massive MI, which is a myocardial infarction.
So this patient was having a heart attack on his honeymoon?
It was just a trip with him and his wife. Called the 911 line. So when they call 911, the whole team responds. I was the lead physician. And he was truly having chest pain. So we got him, brought him down into the hospital. And I'll tell you, these cruise ships have really amazing facilities, healthcare facilities on board. I mean, a small ICU, hospital beds. There's a small morgue. If
really?
The worst of the worst happened. But yes, there it is, a morgue, a 3-bed morgue, 3-bed freezer, I should say.
Oh my gosh.
And then a clinic. But we have a lot of resources at our disposal.
So when you say resources,
we do not have a cath lab.
Right, they don't have a cath lab. So so when you saw him, he was committing chest pain. So what test did you run?
Yeah. So what
did you run, I guess? Yeah, do you have an EKG?
We immediately grabbed an EKG. So we get him down into the hospital, grabbed an EKG, did some stats, CBC, CMP. We did not have the ability to run cardiac enzymes.
Oh, Russ. Okay.
So it was really relying on what the EKG was telling us. And sure enough, he had true ST elevation MIs in his inferior leads. I think I showed you that EKG site. Yeah, I still took a picture because this was classic textbook ST elevation MI.
Yeah.
And as I'm looking at that, he goes into cardiac arrest.
No.
So active CPR in place. And of course, in your mind, you're thinking, where's the cath lab?
Yeah.
Where's the nearest interventional cardiologist?
So if I was to take it back, because to explain it to the emergency or
IVs, obviously morphine. We're following the acute coronary syndrome protocol.
Right.
Aspirin, Plavix, morphine, beta blockers. He's got it all.
So the issue, and if I was to for our viewers, so people who are having heart attacks, there's different types of heart attacks, but the big daddy is called the ST elevation MI. And so if you have an ST elevation MI, there's 2 forms of treatment. You have to, it's you that get to, if you're within 90 minutes of a treatment facility, you get to that treatment facility and they go and try to open up that area.
Right.
Or you get some medication.
Right. I mean, in this particular situation, we know that there is truly injury going on in the cardiac muscle. So he, active CPR, we get the paddles, actually shock him, and we begin ACLS, advanced cardiac life support.
Yeah.
In the meantime, I'm asking obviously for additional help. He is revived and speaking to us, and it happens again.
Yeah.
So you're in the middle of the ocean.
Yeah.
What do you do?
I'm just thinking of like, you are on an island.
I have dealt with this as I was a resident, right? It's amazing how much your skill does come back to you, though, in those moments, right? So my counterparts had notified the first officer, the captain, obviously the head team on the boat, and they say, Dr. Parker, you need to speak to the Coast Guard.
Okay.
Because we need to know if this patient needs to come off of this boat.
Yeah.
Or what do we need to do? The only thing I knew we had was streptokinase, which is a very risky medicine, a clot-busting clot-buster that's going to identify any clot and get rid of it for better reperfusion. And I know from training that you don't really just give this medicine like aspirin, right? Like there is a checklist that you need to follow. So in one hand, you're thinking, do I give this medicine to save his life? Or in the other hand, am I going to give this medicine and kill him?
Yeah.
And how am I going to explain myself, right? But you have to make a decision. I mean, people are looking at you. You have to make a decision. So the first officer escorts me up into the brains of the Royal Caribbean Independence of the Seas. And it's in the middle of the night. We're in the middle of the ocean. And yes, there is a tropical storm.
Oh, really?
We'll add that to the story, okay?
This is the perfect storm.
So
this is the perfect storm.
I'm walking into the bridge, and it is pitch dark. The only thing you can see is the lights blinking in this command center. And there are windshield wipers on the bridge that's barely keeping the rain off of the windows. So you can see anything pitch black.
Now, I've never been on a cruise. Is it rocking? Can you feel it? Or is it pretty safe?
Not too bad. Not too bad. But I'll tell you, to get to the bridge, there's a whole security protocol to get to that bridge.
Really?
It's not like that movie, Under Siege, or that one movie where they take over the cruise ship, right?
I mean,
where you just pop in and take over, the terrorists take over.
I was Steven Seagal. Yeah, that's right.
But there is a whole protocol to get into this bridge, which was fascinating. So I speak again to the first officer, and he is calling command in Miami, and I get to speak to whoever was in charge of the Coast Guard. And I believe I'm speaking to a physician. I'm not sure now that I remember, but I am presenting as I would normally, and I am recommending that we life flight this guy off of this cruise ship.
Yeah.
Now we need a helicopter now.
Is the patient got circulation now? Like, you got a pulse? Or is ZDR still going?
So by the time I had left, he had coded twice, and CPR was in process, and then he was shocked and stable. Okay. And I left.
So he's alive, but he's still got that STEMI.
Correct. Little did I know, as I was talking to the Coast Guard, he was also coding an additional time. Sounds smart.
Poor guy. And you have like a group of people working on him?
So I have the two other physicians that were helping me, and then the team of nurses.
Oh, and me there. Okay.
So I'm just being the communicator to the Coast Guard, United States Coast Guard Command. And I said, I am highly recommending that this patient be life flighted, and we need a helicopter stat.
Yeah.
How soon can you get here? And he said, what is your name again? Dr. Parker. He said, there is a tropical storm. Unfortunately, we can't. As soon as we can get out there, what we're looking at the weather station is probably, 3 or 4 hours. I said, that's not going to be enough time. I mean, this man is going to die.
Yeah.
And of course, we're walking through, what we've done so far to stabilize the patient, checking the balance, dotting the I's, crossing the T's. And I did say we do have streptokinase on this ship.
Yeah.
I'm very nervous to give it.
Yeah.
And
you never given this medication?
Never.
Yeah.
Never. So he said, I'm sorry, you have to do what you have to do. But we will definitely be on standby. So when you're in port the following morning, we'll be there or whatnot. So I took that as I need to make a decision.
Yeah.
And so I went downstairs, got updated report, and me and Dr. Ed made the decision to give this man streptokinase.
Yeah.
And within a matter of seconds, to talk about the amazing power of a molecule and what it did,
Yeah.
all of his ST elevations completely resolved. Like nothing ever happened.
Yeah.
And it was a very much kind of you give the medicine and you wait, right? You're waiting for the bomb to go off,
Right.
because there are so many side effects with this medicine. So we're talking to the wife. Has he had a brain bleed in the past? Yeah. Is he on any anticoagulants? Right. Is he on aspirin? Did he visit Norway in the last 3 months? Right? Yeah. You know, there were all these checks and balances.
Because the risk is that he could potentially bleed out of multiple orifices and with this medication.
Sanguinate and die.
Yeah. And bleed to death.
Correct.
If he has been on blood thinners, just like that.
But I saved his life. We saved his life.
Yeah.
And it was one of those moments that I say, you know, this is what it means to be a doctor.
Yeah.
And you know, the interesting thing is, after we kind of recalled the events and what did we do well, what did we not do well, never once did it cross my mind, oh, we need to get insurance to approve this, or you know, sign here if Medicare is not going to pay for the streptokinase. It was just, you know, be in the moment, be the doctor, and do your job. And it was one of those moments I said, I love being a physician.
Yeah.
It's also very, very terrifying too. So
I mean, you did an amazing job.
yeah, you know, we saved his life. And, you know, as you know, as much as we helped him, you know, he left the ship the next day and went to the hospital. And
So he was awake and alert, oriented.
at that time, yeah,
Wow. Yeah.
he was.
So then, did you guys ever follow up with him by any chance?
No,
I guess not. Like, it's not like,
no,
he
I
doesn't
would
know.
help about him too, just to say, hey, I'm the guy that was there. You know, I think had he been much older or certainly a lot more risk factors, I don't think he would have made it. I think age was on this side, truly in this moment. I mean, the stars aligned well.
Yeah, he's a young guy, absolutely.
But it was very much a situation where I had to make a decision.
Yeah. Yeah.
And it's hard to do when the gut is at your head, right? You have to make a decision.
Well, so I've had the opportunity of taking care of some situations, but they're not as like, you know, life-saving situation.
This is probably a one and done for me, Brad. This is going to the grave.
Yeah, that's right. So have you gone back on cruises since then?
No. So just to kind of finish the story, and that was really the highlight of my experience. But I worked taking care of passengers, taking care of crew. You know, when we would dock at Coco Cay, you needed to have a physician on the island to take care of any potential emergencies while guests are on the island.
Interesting.
And we would trade off. So, for example, if Independence of the Seas was there first, their team of physicians would go to 3 or 4 different huts or stations to take care of passengers or crew. And then we would wait for another cruise ship to relieve us. So let's say Celebrity was the next cruise. Those physicians would have to come meet us. We would give sign out and then we would go back to the ship. So this is another interesting fact that I was attending to an emergency. My radio was not working and we needed to be out of the Bahamas. And these cruise ships have a very specific time frame.
Okay.
You know, you dock on this time and you leave at this time. I mean, time is money in these particular situations. And so I was responding to an emergency. For whatever reason, the other, and no fault to them, but the other cruise ship physician that was there could not find me because I was not in the station. And we were needing to leave. And I'll never forget a group of people on these 4-wheelers coming to say, you know, Dr. Parker, we've been trying to page you. I said, I'm sorry, my radio doesn't work. It has some batteries. Here is the physician to relieve you. Get signed out. We have to go. So they're rushing us back to the dock, and I'll never forget the security and a few other individuals in uniform are escorting me onto the ship as the door is going. And little did I know, fun fact, I'll ask you this question. Can a cruise ship leave port without a captain?
Without a captain?
Without a captain. Do you know that?
No, the captain's got to be a part of the ship.
No, you have officers that will absolutely drag the boat. So yes, you can leave port without a captain. You cannot leave port without a physician.
Oh, really?
Correct. So it was very much a learning experience. But I would say the time that I was there, it was a great opportunity. Highly would do it again if I had the opportunity to do that. So yeah.
You know, I love that sort of high action stuff.
Mm-hmm.
I was just hearing the story of the CPR thing. So I love like running codes. It's one of my things that I enjoy doing. And I mean, it sounds crazy that but it's just when you get, you have return of spontaneous circulation from fluids, it's a very exhilarating feeling. You know, you save this person's life. You have a plan. When I was a second-year resident, and I was always a vocal individual, and I always, I like to be on stage, so I liked the fact that I was in the front. I liked the commanding sort of it, but I was also a resident, right? And the hospital I was working at training in, they didn't have a lot of fellowships, right? So the cardiologist who was at the bedside working with this patient in this situation, he was an attending physician. He was a really smart guy, right? So we had a patient. I got called for a code. I run into the room. It's a cardiac tamponade. So it's a patient whose blood is filling up in the inside of the heart, the pericardium. It's squishing the heart, so it cannot pump and it cannot
also life-threatening.
Right. So this woman coded because of that. So you can do CPR all day long, but you need to get that fluid out. Right. But if you don't do CPR, then you don't get perfusion of the brain.
Sure.
So there's that battle. So
brain injury and
exactly. So I'm running the code. I just started running the code. Now here's the best part. I just started being a teacher for spin cycle. So I was really on the ball of timing. I was like 30 seconds, 20 seconds, 10. I would shout out timing. And when you do spin cycle teaching, you really know like your numbers, your timer, like I am on 2 minutes, right? Nothing is going to get behind. It's just that mentality you get when you got it, right? So I'm counting it down. The nurses are loving it because they're
pushing epi.
Oh yeah. We're running the code, but I'm also running it like it's like timed as a spin cycle. So I'm counting every 20 seconds, 20 seconds down, 40 seconds down, and I'm still setting the meds, right? I'm telling which things we have to do. Now the cardiologist comes in and says, I got to do a pericardiocentesis. Like he's got this big needle and he's got to draw the fluid from that heart. And by the way, I admire this physician so much. He's super smart, really nice guy. And I'm like 30 seconds. And we've been in a pause because we had to do a pulse check. Mm-hmm. And during that pulse check, we pause. He's got to drive this giant needle into the sac of his heart and drain the blood. And I'm yelling at him saying, I'm not giving you any more time because I've got 2 minutes of CPR to go. Like, you got to hurry up. And he's like, hold on. And then he gets it in, and the pressure of the pericardial tamponade was so high, blood shot out to the side of the wall. Wow. And then I was like, resume CPR. I'm like yelling it out. And then we got this return of spontaneous circulation, saved her life. It was one of the most exciting things I'd ever seen. The best part about this was my future boss was sitting outside the room.
Wow.
And he goes, did you just yell at that cardiologist? You're hired. He's like, I like your gym. Yo, that many got in your gym. Yeah, so it was fun. I enjoy that. There's those ones where you save lives, and then there's the ones where
sure,
you balance some sort of interesting situations. We had we have these things called behavioral rapid responses. Mm-hmm. and we had a patient who they had a baby wrapping, and she was really agitated, and she had some mental health issues. And the rapid response was coming in. People were holding her down, and she was at risk for harm for herself. And I noticed that she kept talking scripture in the time of her confusion. So I said, "Can we stop holding her?" And the guys were like, "Oh no, we are at risk. She might hurt us. So let's just try." And we read scripture together, and she was just quoting her Bible, and so I grabbed her Bible. And there was another security officer who was very religious. He was a pastor too.
How interesting.
And so we decided to read. And for 20 minutes we sat and read scripture. And we, without medications, were able to calm things down.
So there's the streptokinase stories and then the power of prayer, right?
The power of prayer.
Wait until she gets that bill.
Yeah, that's right. Well, I couldn't bill it into that.
Tell me, Dr. Seth, your story of being on the airplane. So while I was on a cruise ship,
Yeah.
you were a physician on a plane, right?
Yes.
Snake on a plane.
So I'm like you and I are action junkies, right? Mm-hmm. If I hear a story, if I hear we need a physician on a plane, I'm the first one to jump. Every time I always hear all these physicians are like, "Oh, I hide." No, I'm the first one out there. Part of it's because it gets I fly a little anxious. So I get a little worried about turbulence. So this distracts you. This distracts me. Time goes by. It's great. I had just gone to India to put the ashes of my mother in some of the holy waters in India. At the time, I was a second-year resident. My wife was at home, and my daughter was 8 months, and she just started to crawl. And I can tell you as a father, that's the best time to see your kids. And boy, I was missing her like crazy. Mm-hmm. I was just so excited to get home. Yeah, so I'm on the back of this plane. I swear to God, there must have been 1,000 seats in there because there's 3 on one end, there's 3, and then I'm in the middle of the 6th row. It feels like there's a billion people in this plane. And we're flying for about an hour and a half.
And this was not first class.
No, this was, I think if there was a 4th class, this was that one. It was as far back
in the paycheck.
Yeah, that's right. Yeah, it was a bumpy ride. And I'm hating every minute of it. And I'm also a student, so I'm like, well, this is a plane. And so, there's no drink service. There's no food service right now. It's the middle of the night. It's 4 a.m.
Yeah.
So I'm coming up and just trying to get some rest. All of a sudden I hear, if there's a doctor on the plane, can you come to the front of the plane? And I'm like, this is my chance. I'm out of here. So I get off my chair. I get out to the front, and I see this elderly lady just swinging and punching. And I'm like, oh my gosh, she struck somebody. And I couldn't believe it. And so I go to her and I say, it's okay. I'm a physician. I'm a doctor. Come with me. And so I hold her hand, and she's very confused. She's hallucinating. Yeah. So she's experiencing, what we call delirium. She's sundowning. There's many reasons for this. But many times it's if you're elderly and it's 4 a.m. and they need you to wait in line to get on the plane, you might get confused. Yeah. So anyways, I noticed that she's a little confused, and the flight attendants come to us and say, we have medications, and they open this briefcase, and there's enough medications to run a full code if you need to. There's intubation kit, there's a catheter there, and there's some sedatives, Haldol, that's one of them. So I'm like, okay, we have Haldol. She's agitated. She's confused. We can do that. And she's like, when we sit her in this area where they have the food service area. Mm-hmm. So we got a chair. We got her sitting down. And then at the same time, her husband comes to me, who is also very elderly, and he's starting to hallucinate. And he's like, is she okay? And I said, she's okay. I've got to take care of her.
Were the flight attendants helping you?
Yeah, they were helping as much. To be honest with you, they took off. They found a nurse though, And the nurse came to the room, and she's
They
like,
have coffee service. Bye.
yeah, that's right. She's like, the flight attendant is like, you got this, right? Out of here. So then there was a nurse that came, and she was French, and she was really nice, and she's like, she clearly was sleeping, and they must have woke her up, and they're like, and she's like, what can I help you with? And I was like, I would really love if you get an ID for me. Now, the attending in me now thinks like I would have just given an IM job in the Haldol, but it was only like 2 milligrams, not enough of a dose. I thought she wouldn't have been it would have been as effective. So we got an IV, we gave her a dose of Haldol. She's calmed down.
Good.
We were able to handle it. She was fine. We got her to her seat.
Plane land safely.
Plane land safely. I go back to my room, or I go back to my seat. I try to get some sleep. I think I slept because I remember getting off the plane, and I remember as I'm walking up the plane telling the flight attendant, I have 2 requests for you. And I wrote it on a note. I said, please make sure these both husband and wife are seen by medical professionals as they land. And I wrote it down. I even wrote a summary, like a soap note. I was like 60 or 90-some-year-old female of this earth, hoping that the people in Amsterdam would have appreciated my thoroughness.
Yeah.
And then my second request was, please upgrade me on my taxable IDs. I'm a second-year resident, okay? I'm shooting my shot here, right? So I get to the kiosk for the airline that I'm flying in, and they say, oh, guess what? You've been upgraded. And I go, oh my gosh, I'm so excited. I've never flown anywhere upgraded in my life. So
Is this United Arab Emirates?
No, it was another airline. It was
Rather, we were upgraded to the room that had the shower and that television.
yeah, that we kind of were that, right? Yeah.
I'm standing up every time.
Specs. No, the airline that I was on, they did not have it, but for me, it was an incredible experience. I'm like, so they it was kind of like this booth, and there was a TV, and I slid into the booth, and I always tell this, my steak was medium rare. I was how did you get the steak medium rare? I still don't understand it. I couldn't believe the experience. So we're flying from Amsterdam to Toronto, and I'm thinking this is going to be smooth sailing. And I start to fall asleep, and I'm very comfortable, and I'm like, boy, this is amazing. But an hour into the flight, I get woken up. Were you by a new flight attendant? This lovely lady looks over, and she said, were you the doctor on the previous flight? And I go, yeah. And she goes, you know that patient that you took care of? I'm like, yeah. Well, she's on our flight, and she's assaulted a number of patients.
No.
And then I said, I thought she was a season either. Yeah.
On the flight.
I thought she was supposed to be somewhere else. I thought she should have been taken care of. And she goes, I don't know, but she's on our flight, and she's hit a few passengers. And I'm like, oh my gosh. So I'm like, okay, take me to there. They took me to the side of there was an interesting thing. I didn't even know this. I thought I'd have to go down the main hallway. I went to a side compartment of the plane. I don't know. And so I got to, and then I ended up walking into this area. And as I'm in there, I could hear commotion, and she's this lady, she's confused, she's hitting people, and people are trying their best to calm her down, and she's just super confused. Yeah. So I'm I go here, I say, hey, I call her Auntie. I'm like, Auntie G, this is Doctor. Can I help you? And then she's like, it's a way for no, she recognized me, and she says, they're trying to hurt me, they're trying to harm me, this and that. I said, okay, come with me. And I'm like, I guess I'm going to need to use the briefcase and medication again. As I'm taking her to the same area where the food compartment is, I look down, and she's dragging a catheter bag on the ground. Oh my gosh. And that catheter bag is the size of a balloon. Wow. It's and I'm looking at it, I'm like, that's filled with urine. Yeah. And then I'm thinking,
Number one contributor to delirium.
100%. And not only is that bag full, her bladder is probably full too. That poor thing has been probably having to pee and just can't. And I'm like, oh, okay, we got to figure this out. So I'm thinking to empty the bag, but the bag is sealed. It doesn't have a way to...
And while she is in the chair in front of other passengers, obviously we know how limited space is.
Right. Point. Yeah. So I take her to this area, and I'm like, I got to take this catheter out, and I'm a second-year resident. Okay, I don't know how to take this catheter out. Fortunately, this lovely lady comes up to me, and she says, "My single daughter is a nurse," and I said, "Yeah." She said, "My single daughter is a nurse. She would really like to help you." And I was like, "I will take whatever help I can get." I said, "Thank you so much." And this lady came up. She was amazing. And she's like, what do we need to do? I was like, we need to get this catheter out of her. And we had to drain her. And then, yeah. And then I was like, let's do this. And then she's like, she was incredible. We put her down, laid her down in the middle of like the compartment. We had to like close. There was a curtain. We gave her some privacy.
With the flight attendants helping give some...
No, the flight attendants were like trying to calm down the passengers and the things that were going on. I just had this nurse lady who was helping me. And so she like did sterile techniques because there was iodine. I was able to remove the catheter. We drained her bladder. So much urine. It's unbelievable. And then we had decided to put in a catheter in her because we weren't sure if there was obstruction issues. Because there was another catheter in that briefcase that we...
I'd like to have known what the expiration date was on that catheter on that plane. How often are you putting in a fully catheter?
Yeah.
30,000 feet in the air.
Yeah. So we thought about that and we're like, at this point, we'll just make good decisions to do this. As we're putting it, like she'd emptied her bladder and felt a lot better. She like fell asleep right there. Right. And we're like, oh, goodness, sir. She's like much better. And I gave a hug to the nurse because she did all the work. And I'm like, oh my goodness, thank you so much. So we carried the patient back to her chair. She fell asleep, calmed the rest away.
Amazing.
So I go back to my pod. I'm like, okay, I think I'm going to get some to rest. I try to fall asleep. And then like 4 hours later, I get woken up again. They're like, doctor? And I'm like, again? Like, what happened now? And now I'm a little bit on the snippy side. I'm like, what, guys? And then
you need to land.
That's right. So she says, the pilots would like to talk to you. Wow. And I'm like, oh, what did I do? Did I do something wrong?
The captain has passed.
So we go out of this, like the area that we're sitting in, we go up the stairs, and then we walk into this first class lounge, which, by the way, the nicer first class lounge, which was prettier. I was a little jealous about that. And then they open the door, and as they open the door, I hear 3 guys go, "Hey!" Like, and all excited. And I'm like, everything okay? And then the main pilot turns around. He's like, "You are our hero." And I was like, I just did. They were like, "You don't understand that we would have had to turn the plane around. This would have delayed all sorts of things." I didn't know what details.
They let you in the cockpit.
So they said, the pilot looked at me and says, "We would like to invite you to land to be in our cockpit for the landing into Toronto."
Wow.
And as a guy who has a little bit of fear with flying, and I also thought like, this was like an incredible experience. I was like, this is amazing.
Sure.
So I was like,
this wasn't just some 737.
Oh yeah, no, this is
huge plane.
It's a huge thing. So I was like, if that's okay, I would love, it would be my honor.
Yeah.
And so we sat there, the 2 pilots, the land of the plane. There was another, I guess like a flight, a student or something. He was in the back. He was just strapped in taking pictures. And so we watched the clouds and the CN Tower, and as we're flying underneath the clouds, it was an incredible experience seeing the panoramic view of the city. It will be always etched in my brain. But yeah, that was an incredible experience.
Like me, we will always remember those stories that will define us a little bit and our role as physicians.
Yeah.
Quickly, is there a short story that made you say, this is where I need to go with my career? This is why I want to be a concierge doctor. Is there any stories that you have? That
I actually think there isn't any specific story for me. I think there was like a accumulation of stories. Yeah. I had a big role of being an ethics consultant in my hospital. And it just seemed that it would add up that, patients who had very, very difficult ethical dilemmas, it all came down to, somebody didn't listen to them, or somebody wasn't listening to their concerns, or, the patient's decisions on what they wanted with their body wasn't being, and I just felt like I could provide that to my patients by sitting, listening, and really creating a connection. So that's a big reason why Concierge was a thing for me.
I think for me, and this is a true story, 5 minutes or less, happened in Las Vegas. This was really a defining moment why I said, I need to do concierge medicine, hearing this lady's story. So this is also a fairly young female patient who went in just for a routine pap smear with her OBGYN at an unnamed OBGYN clinic. And it was sort of mid-afternoon, and she already said, Dr. Parker, I was waiting in the waiting room for about an hour, 2 hours, hour and a half. Finally got, and they were rushing, they were busy, but finally got whisked to the room. The medical assistant did her vitals, had me go ahead and get into a gown and get me into position. So she was
in stirrups.
She was in stirrups. Yeah. So laying down, ready to go, and was told the doctor's going to come in. She's going to do her thing. We're going to get you out of here. So sorry to keep you waiting. So she did that. And she said, I was laying down. I was so tired. I was looking at my phone, and I must have dozed off. And I woke up because my hip was starting to hurt and it was cold in the room. And she said, I couldn't hear anything outside of the room. So she moves her leg out of the stirrup, moves her other leg.
Yeah, was falling asleep or something, right?
Gets off the table and has the gown on, opens the door, and the lights are off. The lights are off in the clinic. So she gets dressed, goes out, and they close the office.
There was nobody there.
They forgot about her. Oh. And she says, I was so nervous to walk through this clinic and leave. Is the alarms going to go off? Is security going to arrest me for trespassing? And she said, I will never go back there.
So, like to review, she's in the most compromised position
already
in stirrups.
Already, yeah.
She's degowned in a paper fabric, right?
Right.
Essentially naked on a bed in stirrups,
ready to have this routine well woman's exam.
And then they leave the room.
They leave the room and
turn on security.
And did the medical assistant leave? Was there not a sign out? Like, are you really that busy in an office? What went wrong there? Right?
My gosh.
And so, that was one moment that said, first of all, that will never happen in my our clinics. And secondly, like, are you really that busy that you really can't treat each individual as a person?
Yeah.
Yeah. So that was the defining moment for me. I could go on and on and on with stories that, like I said, shape us and define our career. But I know you have probably a lot more to share.
We're here for Eric. Huh?
I think I'm going to close by saying that, I've learned a lot throughout the years that have made me a better physician, and certainly have challenged us. Like I said earlier, these are those moments that I think make us who we are today.
Yeah. These stories are additive. They are, the learning that you get is cumulative. But
what's the takeaway message?
So I was trying to formulate, how do I say, the experience of the airline or this cruise line, how does it make yourself? And I think that's the best part about medicine is day to day, you just add on some days, big stuff gets added on, small days. But at the end of the day, if it shapes who you are as a physician or as anybody who's taking care of people,
right.
And it makes you see that so many angles to life, and it makes quite a bit of meaning out of the careers that we have.
I think we should do another episode on stories. So if people have comments, want to hear more.
Yeah.
I know I have plenty more.
And that also concludes our episode today for Out of Network Podcast.